Eric said we were going to talk about key strategies a little bit, so we're going to spend a good portion of this afternoon working on key strategies and figuring out, what do they tell us, where do we go from here? And as the group of us that we're preparing for this part of the project, we're reviewing information. We found these strategies which really we felt resonated with our project. Promoting early childhood mental health and home visiting and parenting programs, enhancing support in early parent education, screening parents for depression, screening children for social and emotional problems, developing a better trained workforce, using evidence-based practices to promote effective early childhood mental health programs, parent education and support to children and caregivers, supporting the well-being of vulnerable children, and educating communities what's available and how to access. Kind of the gamut of what we felt was the highlights, the hot points of our issues. The items that are in blue, screening for depression, screening for social and emotional issues, effective evidence-based practices in supporting well-being of vulnerable children, are the 4 that we're going to suggest today that we focus on as a stakeholder group. So I guess the first question is, are there other strategies that we should probably capture here? And we have a parking lot over here as well for other items that we want to be sure and follow up on and get back with you on. But are there other key strategies that come to your mind that go beyond and that we haven't captured here?
Does the screening include educating providers?
I think that is one part of the screening that needs to be a part of it, because if you don't know how, you certainly can't screen.
I think that piece that you're talking about is more under the educating communities, but we might need to specifically call out educating providers.
Yeah, because my sense is that sometimes the physicians might see them, but they all know they're going to provide that. Do you have that in the bullet, developing a better trained workforce?
Yeah, it's not in the bullet. We don't have it in one of the highlighted ones. So if you think it's something, we should add a 5th one.
At least something about training those providers.
Okay. Okay. Yeah. I have that back when we're doing the facilitated part. I'll move that over to a separate sheet so we can do some highlighted specific ones. Any other? I'm sorry. For working with mental health, early childhood mental health in general, and for our group working forward.
I think one of the things that we have to do is expand what we see mental health providers as in terms of, I think what we run into, I see in the disabilities world, that our early childhood special education teachers that are out there in the home doing home, that actually have master's degrees and those sorts of things are oftentimes not seen as having the ability to do mental health services, when in fact they are doing them by the mere fact that we're focusing on the family and the child within the context of the family and addressing the needs the family identifies as distraction. So I think just thinking of people, and we've done some of that with Kate in that endorsement process, and those, I think a lot of those folks that are endorsed are actually part C providers or providers, and then they might even be an occupational therapist or a physical therapist or something like that. You have that ability that actually have a lot more knowledge and subjects that even works with the adult population. So I think we have to think outside the box sometimes in order to make sure that doesn't mean the box might not get a little bit bigger or we might not put them into the box eventually or something like that, but I think we have to get away from just saying only social workers do this, only psychiatrists do this, only psychologists do this.
So broadening this understanding of within this workforce, who's available, what they can do, versus maybe how we've slotted people today.
I think that as we were looking at some other states that do early childhood, they're good at that. I think there are a couple examples, and maybe that's the next meeting that we can pull out and see who else do they include in that bucket. Yeah.
Okay, so you got that?
Yeah.
Okay, great. Anything else in key strategies that we don't have up here that we need to be sure and add? why we're all here.
Another thing that Part C is part of right now is the National Early Childhood, called the Early Childhood Personnel Center, and it's out of the University of Connecticut, and it's a grant through the Office of Special Education Program, and it's looking at early childhood special education and making sure we have a comprehensive system of, I can't think of the acronym right now, CSPD, personnel development, there we go. And we are looking at all of the service providers and really doing a drill down, and Kansas was actually chosen as an intrinsic state to kind of look at their system and mental health. Part of that, because early childhood special ed involves a lot of mental health. So I think that's another, is to somehow eventually kind of make sure our efforts we are including and being part of that. I will also take that forward as well, because that's really
Yeah. Well, it's always just seeming so timely, and as I've talked with all of you and seeing if you'd be interested, it's kind of fun to hear of all the connections you all make in your heads right away.
So the National Early Child Care Center project, is that?
Sarah, you got this captured correctly. That's okay.
You said National Early Child Care Center.
Early childhood personnel center. Is that something you can share? Is there a practice or something? There, I can, actually, KU is one of the regional places, and Dr. Eva Horn and Dave Libanon are in charge of those,
Okay.
in charge of that. And actually, Stacey Park, Dr. Stacey Park is the program coordinator for that, but I can forward you that information.
Yeah.
Okay, do that.
That'd be great.
Okay, great. And yeah, we'll work on strategic planning and such. Okay. That.
Great. So we will glue this bullet, the better trained, developing a better trained workforce, and work on that today as a separate item as well. Are there any other items that you really would like us to pull forward as one of the now 5 main ones that we focus on? And we're not forgetting the others, just they will be there as well. But,